Well, strutting your stuff never had it so bad. High heels are the #1 shoe-related cause of foot pain, according to the American Podiatric Medical Association. I first brought you this story back in April, and now as we strap on our heels for the holiday season, here's a reminder of what doctors think of our fashion obsession. According to a new study, wearing heels can prematurely age knee joints and cause osteoporosis. Researchers at Stanford University scanned the knees of 14 healthy women as they walked wearing shoes with varying heel height. They found that as the heels got higher, the strain on the knees increased, with heels of 3 inches or higher effectively aging the joints by 20 years. The study, published in the Journal of Experimental Biology, also found that wearing heels changed women's posture, caused their ankles to tilt inward, and destabilized their ankle joints. The specialists at Tri-County Podiatry explained the impact that wearing heels can have on your feet and toes over time.
High heels, okay, I get it, I'm a female, you're gonna wanna wear it to your occasions and things like that, but that's where I kind of believe it at. Wearing it out to those special occasions and going from point A to point B is not a shoe I would want someone to generally be in all the time. Why? Because unfortunately it do cause some kind of biomechanical problems in the future. One, tightening of the Achilles or the heel cord. So in the future that can cause an Achilles tendonitis, which is pretty difficult to treat. So you want to prevent it before you even start feeling that problem. Another thing is bunions and hammer toes. Those are a very good cause of it, unfortunately. Why? Because you're putting your foot in that position. You're plantar flexing your foot straight down. You're putting pressure along the bunion and the hammer toes. You're going to put extra pressure on those particular spots, which is going to make your tendons and ligaments lax along those joints and make you even more prone to getting the hammer toes and the bunions. So in a sense, you're kind of helping yourself get to that point quicker than if you were to support yourself with a proper fitting shoe or inserts.
Haglund's deformity, also known as a pump bump, is a bump on the back of the heel bone, usually around the area where the Achilles tendon inserts, and it can kind of be aggravated by heels, hence why the term pump bump comes in. So with those particular deformities, sometimes patients that have certain shoes that rub on there, and sometimes that pulling of the Achilles tendon on that area can cause it to become larger. The actual deformity where the bone is, it's not necessarily going to go away, but the symptoms can be improved with certain modes of therapy.
When you're not wearing a supportive shoe, unfortunately, your knees could be affected. If you keep your knees positioned in the high heel, the effect all day, you're going to start affecting the sides of the joints. And you could work your way all the way up to your hips and to your back because of that.
To learn more about the services and programs Tri-County Podiatry provides its patients at its offices in the villages, click the Unhealthy High Heels story link online at yourhometownhealth.com.